Good evening. I hope this is a wonderful weekend for you. Those of you, most of you, probably going to see this on recording. I decided to do a story on this issue of myocarditis in young boys who get the vaccine. It's been a story, a medical story I've been following somewhat loosely, I'd say, for the last few weeks. There's data on how different organ systems are affected, nervous tissue. Many of you are aware of blood clots that are affected. And we'll do stories on these as well. But what I became aware of more acutely is that there's this spike, if you will, or this increased number of cases that are people reporting in young boys who are having myocarditis. And I'm going to break down myocarditis for you in a few minutes. And many of you may be experts given the fact that you've been looking it up because it's been talked about online. But as a cardiologist, I want to give you a different perspective than what you may have seen online. But before we get into the details of that, let me discuss this case. I just pulled an article out of a magazine, and it pretty much has a lot of the facts. And I looked at other sources and made sure what they presented here is pretty much consistent with what's online with other sources, of different reliable natures. So the title says a 13-year-old Michigan boy dies 3 days after the second dose of the Pfizer vaccine. So the initial autopsy results show that he was a healthy boy, but suffered from myocarditis. Many of you who may not know what myocarditis is, myo meaning muscle, cardio, heart muscle, itis. Whenever you hear the suffix itis, it's usually related to inflammation, arthritis or meningitis. It's an inflammatory process. Most of the time, I don't want to say most of the time, but much of the time is due to an infection, but it does not have to be an infection. So itis, by definition, is an inflammatory reaction. And if it's associated with a tissue, myocarditis, it's inflammation of the heart muscle. So inflammation, we know, is the process that's going on, but it could be due to an infection. It could be due to a toxin that's in the blood or a combination of things. Oftentimes, it's due to your own immune system. So whether there's an infection or a toxin, your body's immune system may be overreacting to that foreign agent, whatever that agent may be, and it may be inadvertently attacking your heart muscle system. And you may also hear the term pericarditis, peri around, cardio, around the heart. And the heart has this fibrous fatty tissue, I should call it a fibrous fatty sac that sits around the heart, and it really insulates the heart. It's sort of like a safety airbag, if you will. In this case, it's a fat bag. So you have this fibrous fatty tissue around the heart that normally protects the heart, and it can become inflamed as well. So you have, hence the term pericarditis. So this 13-year-old Michigan boy died June 16th, 3 days after he get his second dose. And this is important because the peak of these cases occur after the second dose. Now, the preliminary autopsy results show that the heart became enlarged. Now, I want you to put a pin mark in that, enlarged, and was surrounded by fluid. So the heart itself was enlarged. I'm going to talk about what that means in a few minutes. And there was fluid around it. So we talked about pericarditis, and we talked about myocarditis. And so these two descriptions here are quite important in regards to that. So, and I'm just reading some highlights of the story. This is written in a lay article, but it does have some key points. I wasn't able to find the actual autopsy report, but there's some information here that I think we can glean from it. So a week ago today, my brothers, and this is what a family member tweeted on, my brother's 13-year-old son had his second COVID shot. Less than 3 days later, he died. The initial autopsy results where the heart was enlarged and there was some fluid surrounding it. He had no known health problems, was on no medications. So that's important to know. The important thing is that, and here's a image of the tweet. Here's his card showing he had the Pfizer vaccine roughly a month apart. On June 13th was the second dose. The family was devastated. I'm not going to go through this part. There's some interesting comments made here, and these are some health officials who talk about it. So a CDC official, CHD, calls on FDA to take COVID vaccine off the market. They submit a comment: loss of life in the adolescent for any reason is heartbreaking. Health Officer Chris Harrington, MPH, Medical Director Alicia Pruitt, MD, are mothers of children near the boy's age, so it hits close to home for them. RFK Jr., many of you know him. He talks about vaccines. He's considered an anti-vaxxer, but I don't want to get into the political aspects of this, but he does comment: clinical presentation myocarditis cases following vaccination has been distinct, occurring most often within 1 week after the dose 2, with chest pain as most common presentation. And this I've seen on other sources, and this was a quote by Dr. Grace Lee. The CDC finds likely link between heart inflammation and Pfizer Moderna during today's meeting. So the CDC met on this, and they acknowledged about 1,200 cases of heart inflammation reported between the ages 16 to 24 years old. However, on June 23rd, so a little more than a week ago, the ACIP meeting, they acknowledged more than 1,200 cases of heart inflammation between ages 16 and 24-year-olds, mostly occurring in men. That's important to know. However, we get down to here, Dr. Merrill Nass. Despite these cases reports, the CDC, they came out and the recommendation was to continue with vaccination in this age group of boys because they felt that the benefits of vaccination outweigh the risks. And I want you to put a pin in that as well. The benefits of the vaccine outweigh the risks, because we're going to analyze this a little bit in a few minutes. And there were some other comments. Dr. Merrill Nass, an internal medicine physician, pointed out several flaws in the data in the ACIP's presentation. So this is important. When you look at risk-benefit analysis, you're looking at statistics. So if I recommend a treatment for you, and this treatment may be, I'm a cardiac electrophysiologist, so I implant pacemakers and defibrillators. So if I were to recommend implanting a pacemaker, I said, well, or let me put it better, a defibrillator. So sudden cardiac arrest, we know, is the most common cause of dying from cardiac disease. And cardiac disease is the #1 killer. Sudden cardiac death is the #1 cause, mechanism of the #1 killer. And lots of people die from sudden cardiac arrest. So as an electrophysiologist, I said, well, this is a terrible thing. People die from sudden cardiac arrest, all the time. So I think we should implant defibrillators in everybody, because this is a horrible way to die. And so I think it's something that we can consider. And so Alexis Lee, hello from Wisconsin. If we were to take that angle and say, well, this disease is so bad, then this treatment that we know treats this disease should go for everybody, because this potential cause of death, sudden cardiac arrest, could affect everybody. I think I would get a lot of pushback from that. And the reason is that there are a lot of people, JW High from Boston, there are a lot of people who are not at high risk for sudden cardiac arrest. It may be, young females with healthy hearts. They're not at high risk for dying from sudden cardiac arrest. However, somebody who's, 55, 65 with an ejection fraction of 25, who's had 4 heart attacks, they're at risk for sudden cardiac arrest. So we need to take into consideration risk-benefit, but not risk-benefit across the board, but risk-benefit in certain populations. So I want to address that aspect here. I'm not going to get into the hair splitting, but Dr. Mel Nass does make a great point. And as of now, 2 major ways the rate of myocarditis are minimized was to lump people from age 39 and down, even though the highest rates are in youngest kids. So the highest rates of overt myocarditis is in the age group of around 12 to 14. But if you add people from 15 to 39 to that, where the incidence is low, you dilute the overall incidence. So in other words, if I say, well, people who are at between the age of 50 and 75 have a 50% chance of having heart failure, but then people age of 10 to 25 have a 0%. Well, if I had that from 10 to 50 years old, I have 0%. So if I add the 10 to 50 year old to that total number, that reduces that number by half at least. And it may be even more than half if this number of people in the younger group is greater than the number in the higher group. So the point I want to make is simply this. The issue with, looking at this data and making recommendations, you have to be careful of how this data is calculated, how this data is analyzed. That's number one. So basically, the incidence of myocarditis in this population of 12 to 15-year-olds is diluted by adding an older group where the incidence isn't as high. That's number one. And then they also had a very narrow window of time after the vaccines was started. So in other words, they had a narrow window of time after initiation of vaccinations to when they started looking at the data. So that means a lot of young kids did not get their second vaccination. Remember, with Pfizer and Moderna, you get 2 vaccinations, the first dose and the second dose, and they're about a month apart. And so let's say you start vaccinating everybody in December of 2020, but then February of 2021, it's allowed for kids to get vaccinated. So, but then you start taking the data at the end of February, and you miss a lot of second doses, and so you miss a lot of cases. So that's a problem there. So that's a very great point. When they look at the data, they do the risk-benefit analysis. But I've got another point I want to throw in there, but I'm just going to finish some of the comments here. Dr. Leslie Moore make a great point that the VIRS data is atrocious and frightening. And I talk about the VIRS data a fair amount. There have been about 6,000 deaths reported in the VIRS report. Many of you may be familiar with the VIRS report. It's Vaccine Adverse Events Reporting System. This is a system set up by the government for the vaccine to report adverse effects of vaccines. So this is a government-established reporting system. It's not very well known. However, a friend and colleague of mine said, well, it's becoming more known now since the COVID vaccine, and people are talking about vaccines more now, and more people are talking about VIRS. And so this higher reporting system may be skewed based on the fact that, more people are aware of it and more people are reporting on VIRS now than they were, say, 2 or 3 years ago for flu vaccine. So that may be one aspect that why these numbers are bigger. But still, you have 6,000 deaths. That's more deaths reported for COVID than you've seen reported for 70 vaccines over 30 years. Personally, I think that needs to be investigated. It's even though there's a skewed number toward an increased number of reports, I think we need to investigate that because, again, it raises something suspicious about these set of vaccines that hasn't been known before. Plus, these vaccines were developed let me just put it in a non-traditional development. They were developed more rapidly than other vaccines. So we need to take some pause, especially given the fact that we're seeing a lot of reported deaths and a lot of reported comorbidities. So in the VIRS report, they estimate about 1,117 cases of myocarditis and pericarditis, et cetera. So I'm not going to belabor the other comments here. This article does a great job of citing different experts. But let me break down a couple of points, and I'm going to develop some of these issues more in a later video. Point number one, myocarditis. Now, in this young man, it said the heart was enlarged. What does an enlarged heart mean? A heart can be enlarged by 2 mechanisms. One, it could be dilated, or the chamber size can be enlarged. The other way a heart can be enlarged, or it can be thickened. So the heart walls can thicken. And the heart walls thicken by means of swelling. So an enlarged heart can be swollen and dilated. So it can be the swelling. So if you become inflamed, many of you may have, say, fallen off a bicycle or injured your arm, and you get swelling in that area. So swelling is a sign of inflammation. An enlarged heart can be a swollen heart. Now, they also know it's fluid around the heart in the sac. That's called pericarditis, inflammation of the pericardium. So this autopsy, based on the little bit of information we have here, is that this heart became swollen and enlarged. Now, the question is, what was the mechanism of death? I've seen many patients who come in with pericarditis, myocarditis, but they don't just die. So why did this young man die? My suspicion as a cardiac electrophysiologist is that he may have suffered a life-threatening arrhythmia. Now, what is the mechanism there? Anytime you have injury to the structure of a heart muscle tissue, within the inner lining of the heart tissue and also throughout the heart muscle is what's called the conduction system. So inflammation, or the heart's electrical system. So just think of it as your house. Maybe your house gets water damage. So if your house gets water damage, you have damage to the drywall. You can also get damage to the electrical circuitry of your house. If your house catch fire, you can have damage to the drywall and also electrical circuitry of the house. But if you get damaged wires, these wires can short circuit and they can cause a fire in the house. Similarly, your electrical system in the heart can short circuit. A short-circuited electrical system can put you in a life-threatening arrhythmia, and that can cause sudden death. So it's very possible this young man died in his sleep or dropped dead, while awake, secondary to life-threatening arrhythmia. So myocarditis causes inflammation of the heart muscle, but it indirectly can damage the electrical tissue, and it could have put him at risk for a cardiac arrest. And this is probably the mechanism by which he died. You may get, 10, 20, or 100 young men with myocarditis, and maybe only one will die due to sudden cardiac arrest. But again, one is too many. So that's one point. The other point I want to make, and again, I'm going to develop this more in future talks, is myocarditis. Is it affecting older people? And the reason I raise this as a question is that I'm seeing a lot of older people in my adult cardiology practice, and I saw patients yesterday and the day before, and they come in and say, well, doctor, after I got the first shot, I started having more palpitations. Palpitation is a sensation of either a rapid heartbeat or irregular heartbeat or pounding the chest, and people refer to it as palpitations. What I'm thinking is that there's some irritation in the heart muscle. Now, do they have frank myocarditis? Do they have an enlarged heart or swelling around the heart? If I do echoes, I don't see large amount of fluid around the heart. I don't see excessive enlargement of the heart. Now, some people have an enlargement of the heart, but my population of patients, they have an enlargement of the heart for a lot of reasons: high blood pressure, diabetes, etc. So I can't say that they are having, vaccine-induced myocarditis. But we do special markers to look for myocardial stress and the like, and we are seeing some increase. I don't have enough data to say, oh yeah, there's a trend or whatever the case may be. But my suspicion is that, yes, we do have evidence that the spike protein that's associated with the vaccine has cytotoxic effects on different organs or organ systems. And again, it's not too far of a leap to say, well, there could be a cytotoxic effect. Cytotoxic meaning damage to cells. So a cytotoxic effect on the heart may mean damage to heart muscle cells. So I think that we should be mindful of the fact that this mechanism of death in this young man was probably due to, or possibly due to, a cytotoxic effect on the heart muscle, which caused him to have sudden cardiac arrest. Is myocarditis a death sentence for every young man? No, not necessarily. However, again, the last point I want to make before I sign off today is this concept of risk-benefit. So if the CDC makes a judgment, okay, let's continue the vaccine because the benefit of the vaccine outweighs the risk. So what was the risk of this 13-year-old dying from coronavirus? Virtually zero. And it's probably the risk for every other young man in his age. Virtually zero chance of dying from coronavirus and a very small chance of developing myocarditis from coronavirus. And if he did develop myocarditis from coronavirus, he likely wasn't going to die because, again, the overall mortality for young people is virtually zero. So when we look at the risk-benefit analysis in this population of people, we really need to pause and think about what we're doing by mass vaccinating young people. I understand the CDC and the ACIP made that recommendation to continue to vaccinate, but I want to call into question our way of making these analysis, because we need to take pause, because we're starting to see this increased number of myocarditis among young people. It may not only be in young people, it just may be more manifest in young people. Older people may be getting it. Their manifest disease may come later. It may take 12 to 18 months before you start to see a peak in older people. So with that, I thought I'll leave you there. I will come on. I'm going to talk about the pathophysiology of myocarditis from a cardiologist standpoint. And also, I'm going to give you some insight in terms of what you can do about it. Many of you may have gotten the vaccine. I don't want you to be nervous or fearful. If you're having some adverse effects, I think there are ways that you can treat yourself naturally to suppress any adverse effects from COVID, whether it's long COVID or acute COVID, or vaccine-induced side effects of vaccine-induced adverse reactions. But I think we need to be mindful as a health industry to think about our recommendations for treatment of this virus. And so I'm going to try to look at a few questions here, see a couple of points made. I won't be on for long. Alexia Lee says she has bradycardia. Bradycardia is a brachycardia. That's okay. Brady, I think you're saying bradycardia. That's the slowing of the heartbeat. And so somebody said they saw a woman outside jogging with a mask. Blame the vaccine makers. A lot of interesting comments here. But anyway, if you enjoyed this information, please please subscribe to the channel. If you haven't subscribed, press the like button, give us a thumbs up so other people can get this information. And of course, share this information. I think this insight can be very beneficial to lots of people, especially family members who are considering getting their kids to be vaccinated. I don't want to come across as an anti-vaxxer, but I do want to come across as a physician, a specialist in both internal medicine, cardiology, and cardiac electrophysiology. I achieved triple board certification, taking care of lots of sick patients over the years, and I have specific insight into this area, and I want to try to help the general public in terms of understanding this. So anyway, I hope this has been helpful to you. Again, like, share, subscribe, and also hit the notification button so you can be made aware of future broadcasts that I do. Until next time, I look forward to seeing you.